So this is an exciting project that I had a chance to work on, and as you said, it's a phase 2 clinical trial looking at Azacitidine and Ruxolitinib combination in patients with MDS MPN overlap syndromes. So MDS MPN overlap syndromes are a pretty interesting group of diseases because they kind of share both morphologic and pathological features with MDS and MPN, and they've historically been a tough disease type to deal with because they have a high rate of transformation to AML, and also, except a few subtypes, have an overall poorer prognosis, with like most studies talking about overall survival of like 1 to 2 years. So this combination was started because azacitidine is a commonly used drug for MDS, as you know, and ruxolitinib is for MPN. So trying to combine those two together in these overlap syndromes to try to get disease activity in both these spaces. So this was a phase 2 clinical trial. 52 patients were enrolled in the overall study, and we are presenting here at ASH the 5-year follow-up or long-term follow-up results. So out of these 52 patients, we had an even balance of chronic myelomonocytic leukemia and MDS MPN unclassified, which now with the new classification is MDS MPN not otherwise specified. And so 24 patients with MDS MPN-U and 23 patients with CMML. And the primary outcome was overall response rate. And in our study, we had an overall response rate of about 54%. So 28 patients out of the 52 had an objective response per the MDS MPN response criteria, which is pretty exciting with this disease space. And looking at the survival outcomes, so with a median follow-up of around 60 months, we had overall survival of around 32 months and a PFS of 13.8 months. Interestingly though, when we broke down these the survival into the disease subtypes, the patients with MDS MPN unclassified or the not otherwise specified category had a median OS of 52 months. And I think this is the big message from the study, from the long-term follow-up, that I think especially in patients who have MDS MPN not otherwise specified with high-risk disease, that is higher number of blasts in the peripheral blood or in the bone marrow, they might really benefit from using frontline AZA-RUX combination. You know, in terms of safety and tolerability, this was an overall well-tolerated regimen. There were no new safety signals. Azacitidine and ruxolitinib, we had predicted side effects like thrombocytopenia, leukopenia, risk of infections. There were 2 patients who had to come off the study because of excessive adverse effects, but otherwise most of these were reversible. So I think it's safe, well tolerated, and we also found out that patients who go into allogenic stem cell transplant do much better compared to patients who are not eligible for it. So I think this is an exciting new development that we can show, especially for patients with MDS MPN unclassified.